Hello, hi friends, good morning. Welcome to our channel, The Voice of Nurse. Today we are going to discuss part 2, point of view medical surgical nursing. We already finished part 1 from question number 1 to 30 questions. We already finished in part 1 in previous days. Now we are going to discuss from 31st question to 60 question. Anybody watching first time my channel, please subscribe my channel, click on the bell icon for further notification, give a like. Next move on to topic. This is part 2, continuous topic of medical surgical nursing point of view. Before moving on to topic, a small request friends. Moving on to topic, I want to clarify one doubt from my viewers. That is, this is MHRB subjects only. I am going to already discuss the topics all regarding the nursing point of view. MHSRB subject wise I am discussing with you. Don't confuse friend, this is MHSRB subject. According to subject wise I am discussing 100 picked important questions in the subject wise. Let's move on to topic now. 31st question. What is brown squad syndrome? What is brown squad syndrome? We will see the options here. Option A, lateral cord syndrome. Option B, anterior cord syndrome. Option C, central cord syndrome. Option D, none of the above. Brown squad syndrome, also called as BSSS. BSS means brown squad syndrome. Here, what is brown squad syndrome? BSS is a rare neurological condition characterized by a lesion in the spinal cord which results in weakness or paralysis on the one side of the body. It is called as brown squad syndrome. Not only paralysis of one side of the body, not only the paralysis on the one side of the body, it may be and loss of sensation on the opposite side also. This is called as brown squad syndrome. Brown squad syndrome is occurred at the lateral cord spinal cord. So here option A is the correct answer. Here in this picture we can see the brown squad syndrome, our cross section of the spinal cord picture. Here option A, lateral cord syndrome is the correct answer. Next move on to question number 32. GABA. GABA refers to options. Option A, glucose aminobutyric acid. Option B, gamma aminobutyric acid. Option C, galactoaminobutyric acid. Option D, gamma aminobutyric acid. Here options are little bit confusing options here. GABA refers to what? We will discuss now. GABA means gamma aminobutyric acid. Option D here correct answer. GABA is a amino acid that functions as the primary inhibitory neurotransmitter for the central nervous system. The main function of GABA is to reduce neurological excitability by inhibiting nerve transmission. GABA is a modulator of anterior pituitary hormone secretion by hypothalamic and pituitary action. So here GABA is a amino acid which is gamma aminobutyric acid. Option D is the correct answer here. Next we will move on to question number 33. The 33 question. Nursing education of a client with oral iron therapy includes. We will see here option. Take medicine on empty stomach. Option B, citrus fruits for absorption. Option C, don't take medications along with milk and milk products. Option D, all of the above. As a nurse, we have to educate the client with oral iron therapy is included. Take medicine on empty stomach, citrus foods for absorption, and don't take medication along with milk and milk products. So here option D is the correct answer. Additionally, we will see here iron. Iron is a best absorbed when taken on the empty stomach with water or juices. They can take for iron oral therapy drugs. Means about 1 hour before meals and after the 2 hours of meals they can take an oral iron tablets. The normal iron value is 70 to 175 mcg for DL for men, 50 to 170 mcg for DL for women. Here difference between male and female means men's and women's difference value is there. In normal iron is in men 70 to 175. In women 50 to 170 mcg for DL. Here nursing education of client with oral iron therapy. Here option D, all of the above is the correct answer. Next we will move on to question number 34. Blue-grey birthmarks on forehead and eye of the person indicates. So, the blue-grey birthmarks on forehead and eye the person is indicates to. We will see here options. Option A, scabies. Option B, impetigo. Option C, nervous of Otta. Option D, vitiligo. A condition marked by brown, blue or grey patches usually on the inside of the eye around the eye is called as nervous of Otta So here birthmarks, blue-grey birthmarks on forehead or eye of a person is indicated to option C, nervous Otta is the correct answer here. Nervous of Otta is a condition where hyperpigmentation occurs around the eye and sometimes in the eye itself it will be happen. Here we can see in this picture the nervous Otta in the eye itself blue or grey birthmarks means here some of the grey color birthmarks is there in the inside of the eye. This is called as nervous of Otta. Next move on to question number 35. According to rule 9, which of the following considered to be a largest area in body? Rule 9 is there in burns. Okay friends, according to rule 9, the largest area considered in our body means burn injuries happen for one person. What is the largest area in the body? We will see here options. Option A, right leg. Option B, left arm. Option C, anterior upper chest. Option D, face and neck. According to rule of 9, burn surface the front and back of each arm. Head equal to 9% of body surface area. The chest equal to 9%, stomach equals to 9%, upper back equals to 9%, lower back is equals to 9%. But front and back of each leg, foot equal to 18% of body surface area. So here right leg is the correct answer. Option A here. According to rule 9, the largest area in body is right leg. Here in this picture we can see the rule 9 for burn injury. Face 9%, anterior chest 18%, means anterior and posterior. Next 18%. Then hands means arms 9% and legs, those are right and left leg is 18% and genitalia is 1% here. Rule 9 of a burn injury, the largest area is right or left leg, but here in this option right leg is there, so here option A is the correct answer. Next we will move on to question number 36. Romberg test for, we will see here option. Option A, test for vertebral acuity. Option B, test for voice. Option C, test for visualization. Option D, test for temporal bone. Romberg test is a test that measures a person's sense of balance, especially the test assesses the function of the dorsal column of spinal cord. So here the central nervous system is involving, means vertebral column. So here option A, test for vertebral acuity. He is the correct answer here, option A. In this condition, problem are common in cerebral palsy, but unknown etiology is there in this condition. Here Romberg test for option A, test for a vertebral acuity. Next to move on to question number 37. Reconstruction of body's form or function is called as, the body is reconstructed again and function, it make a functions, means it is called as. We will see here options. Option A, grafting. Option B, plastic surgery. Option C, extension. And option D, none of the above. In this question, reconstruction is there. What is reconstruction? Reconstruction is also called as reconstructive plastic surgery. So, reconstructive plastic surgery also used to correct congenital abnormalities, means birth defects and developmental abnormalities. So here plastic surgery, no doubt here option B, plastic surgery is the correct answer. Reconstructive surgery is plastic surgery to help restore form a function to some part of the body due to the injury or infection or related to any diseases or tumor. So here the plastic surgery is reconstructive body or function of the body is called as plastic surgery. Here option B is the correct answer. Next we will move on to question number 38. What is retrograde menstruation? What is retrograde menstruation? We will see here painful menstruation, option A, option B, absence of menses, option C, backflow of menses, option D, none of the above. Here retrograde menstruation means, we will see afterwards. What is painful menstruation? Painful menstruation means dysmenorrhea. Absence of menstruation means amenorrhea. Here black flow of menses. D is none of the above. See here option C is the correct answer. Retrograde menstruation is known as backflow of menses. We will see the retrograde menstruation means clearly. Retrograde menstruation is when the period flows upward through the fallopian tubes into the pelvis instead of vagina. Is called as retrograde menstruation. Retrograde menstruation may leads to endometritis also. Some of the times retrograde menstruation leads to, means can be cause of endometriosis. Here in this picture we can see the backflow of menses. Retrograde menstruation, the periods flow upward to the fallopian tubes into the pelvis instead of vagina. We can see here in this picture the fallopian tubes with the backflow of menses. Next move on to question number 39. Drug of choice for swine flu. Note, see, this is something, some of the typing mistake friends. Swine flu. Drug of choice for swine flu. We will see here options. Option A, acyclovir. Option B, adifovir. Option C, cidofovir. Option D, oseltamivir. Swine flu is also called as H1N1 influenza. To treat a flu is oseltamivir. Option D is the correct answer here. Oseltamivir, janmivir, paramivir are usually prescribed for a 5 days of doses. Drug is indicated for treat for a H1N1 influenza A virus. Inhibitors are oseltamivir and janamivir. So here there is no janamivir. So here option D is there. Oseltamivir is the correct answer here. H1N1 or swine flu, drug of choice is option D, oseltamivir. Next we will move on to question number 40. Which one of the following is DNA virus? We will see here options. Option A, hepatitis A. Option B, hepatitis B. Option C, hepatitis C. And option D, hepatitis D. In these options, we already discussed regarding hepatitis B in previous video in the questions 30, in between the questions. And hepatitis B means serum hepatitis. So here except B is the option. We can see here option A is called as hepatitis A, classified as a hepatovirus. So hepatitis A is also called as hepatovirus. It is a small unenveloped symmetrical RNA virus. So here one of the following is DNA virus in this option. Option A is the correct answer here. Option A, hepatitis A virus is correct answer, which shares mainly of the characteristics of the family causes of infection or epidemic hepatitis transmitted by fecal or oral route. So here DNA virus is called as hepatitis A. Next we will move on to question number 41. All are the organs of lymphatic system except from the following. These all are the organs of lymphatic system from the options. One is the except option is there. We will see here options. Option A tonsils, option B spleen, option C thymus, and option D is pancreas. Lymphatic organs are bone marrow, spleen, thymus, lymph nodes and lymphatic vessels, tonsils and adenoid, and also appendix. Many conditions can affect the vessels, glands and organs that make up lymphatic system. So here in this lymphatic organs are thymus, spleen, tonsil. These all are the lymphatic organs are the lymphatic system. So here except lymphatic organ is option D pancreas. Option D is the correct answer here. Here in this picture we can see the lymphatic system organs, not complete organs. I am showing only in these options tonsils, thymus and spleen, and liver also is included here additionally. Next we will move on to question number 42. Rice water stool is a finding of which disease? If some or the patient is having rice water color stool, that indicates to which disease? We will see here options. Option A typhoid, option B cholera, option C amoebiasis, option D ulcerative colitis. About 1 in 10 people with cholera will experience severe symptoms which in the early stages included profuse watery diarrhea, sometimes described as a rice water stools, means the stool color is in the rice water color. So here option B cholera is the correct answer. The stages included profuse watery diarrhea in the 1 in 10 people which is occurred in cholera. So here option B is the correct answer. Next we will move on to question number 43. To avoid pulling the urinary catheter, nurse should tape the catheter on patient. The nurse should keep a tape of urinary catheter which side? We will see the options here. Option A upper thigh, option B lower thigh, option C foot, option D hind leg. To avoid a pulling urinary catheter, nurse should be taped on the upper thigh is the correct answer here. Option A, the upper thigh. To avoid pulling the urinary catheter, nurse should tape catheter on the patient upper thigh. Catheter needs to be completely secured with a tape. The thigh is the best site for a taping for avoiding pulling of urinary catheter. So here option A is the correct answer, upper thigh. Next we will move on to question number 44. Focal length of the lens of a normal human eye is about the distance of normal eye focal length is how much? We will see here options. Option A 25 centimeters, option B 1 mm, option C 2 to 5 mm, option D 2 to 5 centimeters. The distance of 25 centimeters is known as the near point of the eye. So here is option A 25 centimeters is the correct answer. The human eye can see objects clearly without any strain on the eye when an object is placed at least 25 centimeters away from the eye. So here option A, clearly option A is the correct answer. Next we will move on to question number 45. Before giving a blood transfusion, a nurse must note the date, time of collection and must be aware that packed RBC can be stored up to how many days of duration. We will see here option. Option A 25 days, option B 32 days, option C 45 days, option D 55 days. Packed RBCs are stored in blood bank refrigerator at a temperature of 1 to 60 degrees centigrade until issue. The shelf life is 42 days from the date of collection. The expiry date is located on the unit, means the expiry date is located on the blood bag itself. The role of nurse. Nurse should have to note a date and time of collection, must be aware of the duration. How much is duration? It between the how many days? The 45 days, nearby is there 42 days. So here option C is the correct answer. But nurse should have to monitor maintain the vital signs before blood transfusion, and we have to check especially temperature of the patient, and also, and not only in bag identification, duration and expiry date of the bag, we have to check the patient vitals, and especially main important thing is viral markers of the patient. We have to know the viral markers of the patient, and we have to know the blood group of the patient before transfusion of the blood to the patient. So here option C, 45 days is the duration of the RBCs in the blood bank. So option C is the correct answer. Next we will move on to question number 46. For a percussion and postural drainage of lungs in a bronchiectasis, which position is suggested to patient? Percussion and postural drainage of lungs in case of bronchiectasis is a helps to drain a fluid out of the lungs. So here we will see here options which position nurse should provide to the patient. We will see here options. Option A, supine position. Option B, prone position. Option C, semi-flowers position. Option D, lithotomy position. So the body position for a postural drainage is lying on back, supine positions. Sometimes it will be easy in sitting position also, or sideline position also, with the postural drainage get into a position that helps to drain fluid out of the lungs to treat the prevent an infection, and also increase a breathing, means difficulty in case of patient is having difficulty breathing after taking the postural drainage, the patient will feel in breathing better from the previous, means breathing freeness is there here after the postural drainage procedure. So here option A, supine position is the correct answer. Next we will move on to question number 47. What is the first thing to be examined in a unconscious patient due to the accident? The first thing to be examined in a unconscious patient due to the accident, we will see here options. Option A, patency of airway. Option B, hemorrhage. Option C, fractures. Option D, head injury. The initial step in the evaluation of an unconscious patient is to evaluate for the basic sign of life, to examine a pulse followed by assessing airway patency and breathing pattern is important. Here the option A, patency of airway is the correct answer. Primary thing to be examined in a unconscious patient is patency of airway. If it is necessary, we have to begin a CPR, cardiopulmonary resuscitation we have to do. It is one of the saving a life immediately. It is a saving life immediately. Next move on to question number 48. DMPA is an injectable contraceptive. What is the interval between the every dose? DMPA is one of the type of contraceptive method and also injectable contraceptive. The interval between the doses, how much? We will see here options. Before options, what is DMPA we have to know. Depot medroxyprogesterone acetate. DMPA means depot medroxyprogesterone acetate injectable contraceptive. We will see here options. Option A, 2 weeks. Option B, 3 weeks. Option C, 3 months. And option D, 2 years. DMPA is injection should be given every 3 months. If you wait longer than 3 months between the injection, you might need to a pregnancy test before your next injection. Means the 3 months in between you have to take. More than 3 months duration is crossed, means that person should go for the pregnancy test before the next injection of the DMPA. So here option C is the correct answer. 3 months or 13 weeks. Not exactly here 3 months. Also in weeks 13 weeks is the correct answer. Here exactly in 3 months or 13 weeks. So option C is the correct answer. Next we will move on to question number 49. Spinal anesthesia given usually at which level of the spinal cord? The spinal anesthesia position from the spinal cord, the position, which position we will give, means not only position, which level. We will see here option L, L2 to L4, option B, L1 to L2, option C, L5 to L6, and option D, L3 to L4. Here L means lumbar. Okay friends, spinal anesthesia needle should be inserted below the between L3 and L4 space or L4 and L5 space. In order to injury to the spinal cord, space is called as intrathecal space or subarachnoid space. Option D is the correct answer here. L3 to L4 is the correct answer here. The spinal anesthesia given usually the level of spinal cord is L3 to L4. It is called as intrathecal space or subarachnoid place. Here in this picture we can see the spinal anesthesia is given by the anesthetic in the level of L3 to L4. Next move on to question number 50. When helping or assessing a stroke patient, nurse should be assessed. Assessing the stroke patient, nurse should be maintaining which side of the patient. We will see here options. Option A, on weak side. Option B, on strong side. Option C, from behind. Option D, from the back. While helping a stroke patient, a nurse should stand at the patient weak side. Why? Why? Because of nurse should support the weak arm with her hand and grabs the belt at the patient's back. A nurse should always lift her legs, patient legs, not the back. We had to support the patient to the weak side and providing support with lifting hands and legs. We have to do a assessing the patient with the weak side. So here option A is the correct answer. Assessing a stroke patient, nurse should assist a weak side. Option A here correct answer. Next we will move on to question number 51. Osmotic Demyelination syndrome. Osmotic demyelination syndrome results from which of the following condition? We will see here options. Option A, polydipsia. Option B, delayed treatment of hyponatremia. Option C, rapid onset hyponatremia. Option D, rapid correction of hyponatremia. What is osmotic demyelination syndrome? The osmotic demyelination syndrome is one of the complications of neurological condition. Due to the too rapid correction of hyponatremia, risk to the neurological complications such as a osmotic demyelination syndrome. Even with severe hyponatremia, serum sodium concentration should not be increased by more than 80 milliequivalents per liter over the first 24 hours. Clearly, I will explain in easy method. In case of patient is having hyponatremia, we can't treat a more than means a rapid correction should not be avoided to the patient. Why? Because of if we are giving rapid correction to the hyponatremia cases, patient will develop osmotic demyelination syndrome like a neurological condition. We can treat the hyponatremia. First few hours of treatment of severe hyponatremia corrected to the 0.5 milliequivalents per liter per hour. We have to give slow doses to the patient, the hyponatremia patient, to correction of the hyponatremia. So here osmotic demyelination syndrome is due to the too rapid correction of hyponatremia. So option D is the correct answer here. Next we will move on to question number 52. A nurse is caring for a client with an ileostomy, understands that the client is risk for developing which acid-base disorder. Means a nurse caring a client with ileostomy. The nurse understands that patient is risk to developing a acid disorder, means acid-base disorder. What is the disorder of options? We will see here from the options. Option A, respiratory disorder. Option B, metabolic alkalosis. Option C, metabolic acidosis. And option D, respiratory alkalosis. Here ileostomy, the condition is ileostomy. So means the gastrointestinal system is involved in this Question. The intestinal secretions are high in bicarbonate and may be lost through enteric drainage tubes or ileostomy or with diarrhea. This condition results in metabolic acidosis. So here option C is the correct answer, metabolic acidosis. Here the patient is having the developing of acid base disorder. Next move on to question number 53. The term pink buffer refers to the client with which of the condition, means the term pink buffer refers to client which of the condition from the following. We will see here options. Option A emphysema, option B chronic obstructive bronchitis, option C ARDS, and option D asthma. Here what is emphysema? Emphysema means a disorder affecting the alveoli of the lungs. Here option A disorder affecting the alveoli of lungs. Next what is chronic obstructive bronchitis? The blue blotter because cyanosis of the nails. The blue colored blotter because of the cyanosis of nails and nail buds. Here option C what is ARDS. ARDS means acute respiratory distress syndrome. In this question here the term pink puffer refers to client is which condition, means we will see here detailedly. Pink puffer is a generalized term for a person who is thin, breathing fast and is pink colored. It is an old term for the emphysema. This is one of the old term for the emphysema. Now it is recognized as a severe emphysema. So here option A emphysema is a term pink puffer condition is pink puffer condition. Here option A emphysema is the correct answer. Next we will move on to question number 54. The function of choriod plexus. The function of choriod plexus. We will see here option A to produce blood, option B to produce lymph, option C produce CSF cerebrospinal fluid, option D all of the above. The choriod plexus is present in our central nervous system. So here related to central nervous system option is there, option C produce CSF means cerebrospinal fluid. One of the primary function of the choriod plexus is produces CSF fluid via the ependymal cells that line the ventricles of the brain. This is the primary function of the choriod plexus. The secondary function of the choriod plexus serves as a barrier in the brain separating the blood from the cerebrospinal fluid is also known as blood CSF barrier. So here function of choriod plexus is produce CSF. Option C here correct answer. Next we will move on to question number 55. Which of the following tools is used to assess risk for development of pressure sore in patients? Patient is having bed sore. How we will tool means how some of the scale is there in bed sore. So the assessment risk of development of pressure sore scale from the options. Option A MHC scale, option B Waterloo scale, option C Morse scale, option D all of the above. Here option D is the correct answer, all of the above. The assessment of risk of development of pressure sore patient is MHC scale, Waterloo scale and Morse-Fall scale MFC. Here pressure ulcer also called as bed sore or pressure sore. They can form when our skin means the patient can develop the pressure sore due to the soft tissue press against the harder surface such as prolonged time on the chair or bed. This pressure reduces blood supply to the area of the body. Due to the lack of blood supply can cause the skin tissue in the area to become damaged or die. Due to the damage or die, lack of blood supply to the particular tissue or skin will develop a pressure sore or bed sore. These all are the scales, the MHC scale, Waterloo scale and Morse-Floll scale. Here in this picture we can see the MHC scale, fall risk assessment tool. Here in this picture we can maintain the risk of assessment of the pressure ulcer patient. Here we can see in this column age, the required elements in the pressure ulcer form is age 65 plus, diagnosis and prior history regarding fall history, and incontinence, visual impairment, impairment of functional any mobility, environmental hazards and cognitive impairment, pain affecting the level of function. This is the MHC tool assessment for pressure ulcer form. Here in this picture we can see the water flow scale, means this is one of the risk assessment tool for the bedsore patient. Here also we can see the age, cognitive function, and also mainly we can see here the diagnosis, history of any fall and cognitive function, impairment of the cognitive and environmental hazards. These all are the things is there in this pressure ulcer form also. So here in this question 55 question, option D is the correct answer. MAHC scale, Waterloo scale and Morse scale, all of the above is the correct answer here. Next we will move on to question number 56. Which is the best test for detecting liver dysfunction? We will see here options. Option A SGOT, option B serum albumin, option C serum bilirubin, option D prothrombin time PT test. Here option A SGOT is there in short form. What is SGOT? SGOT means serum glutamic oxaloacetic transaminase, serum glutamic oxaloacetic transaminase. So here the best treatment for detecting liver function is ALT and AST test, measure enzymes that our liver releases to response to damage or disease. Albumin test measures how well the liver creates albumin, while the bilirubin test how well it is disposes the bilirubin. So here the liver dysfunction test is option B, serum albumin is the correct answer here. Next we will move on to question number 57. Bell's palsy means the Bell's palsy affect which nerve? We will see here options. Option A second cranial nerve, option B third cranial nerve, option C fifth cranial nerve, option D seventh cranial nerve. The Bell's palsy is results from the damage to the seventh cranial nerve. So here option D is the correct answer. Seventh cranial nerve is facial nerve. So here Bell's palsy result from the damage of seventh cranial nerve, facial nerve. Pain and discomfort usually occur in the one side of the face and head. The Bell's palsy is occurred into the one side of the face and head. So here option D seventh cranial nerve is facial nerve is the correct answer. Here we can see the facial nerve in this picture. Next we will move on to question number 58. The 58th question is, the amount of blood pumped by each ventricle during ventricular contraction is termed as. The amount of blood pumped by each ventricle during the ventricular contraction is called as, we will see here options. Option A stroke volume, option B tidal volume, option C cardiac output, option D heart rate. So here during the cardiac cycle each ventricle pumps out approximately 70 ml of blood, which is called as stroke volume. So here option A is their stroke volume. So here option A is the correct answer. Stroke volume is a volume of blood pumped out of the left ventricle of the heart during the each systolic cardiac contraction. So here option A is the correct answer, stroke volume. Next we will move on to question number 59. Which one is the most important drug in the management of anaphylactic shock? In case of patient is having anaphylactic shock, the management or drug of choice for anaphylactic shock. We will see here options. Option A atropine, option B adrenaline, option C deriphyllin, option D aminophylline. Here the adrenaline also called as epinephrine. Epinephrine is the first and foremost important treatment for the anaphylaxis shock or anaphylactic shock. Most important treatment for anaphylaxis and should be administered as soon as recognition of the condition to prevent a life-threatening symptoms due to the anaphylactic shock. If we are identified a patient with anaphylactic shock, immediately we have to administer the adrenaline dose because we have to prevent the life-threatening symptoms of the patient. Next we will move on to question number 60. This is last question in this video, part 2 of medical surgical nursing point of view. Next we will continue from the 61. The 60 question. Hematochezia usually indicates lower GI bleeding but may result from one of the following. Hematochezia is usually indicates a lower GI bleeding, but the condition is result from the following the options. Option A, bleeding from right colon. Option B, ingestion of supplemental iron. Option C, upper GI bleeding. Option D, ingestion of bismuth. Before discussing the options, we have to know what is hematochezia in this question. Hematochezia is the passage of fresh blood from the anus or usually or with or without stools. So hematochezia means fresh blood from the anus with or without stools is here hematochezia. In this question only is there the hematochezia usually indicates lower GI bleeding. If we are having lower GI bleeding means automatically from the upper GI tract we got to the lower GI tract to bleeding. The upper GI bleeding, gastrointestinal tract bleeding with rapid transmit of blood through the intestine. If blood in stool means the bleeding some of the places we are having in digestive tract. The bleeding is having in our digestive tract. So here from the upper portion of the GI tract it will come to the lower GI tract, then it will come out to through the anus. So here upper GI bleeding is the correct answer, option C. The blood in stool may be bright and dark color, shiny or streaky. It is called as melena. Some of the condition we can see the stool occult blood we can hear already in hospitals. This is the hematochezia, upper GI bleeding is the correct answer here, option C. This is the last question in this video, part 2 from the medical surgical nursing point of view. Next video we will discuss from the 61 question. From the 61 question we will discuss from the part 3 video. Anything regarding topic, any doubts, give me a comment. I will give a answers clearly. And thank you for watching my channel. Please give a like and comment. Please subscribe my channel. Click on the bell icon for further notification. Stay tuned friends. Thank you. Thank you for watching.